Now that some patients have been created, the provider can now start a chairside assessment. Today I'm going to show you the periodontal risk assessment. Choose your patient from the Browse Patient list. If you have not yet created the patient in your account, you will have to do that prior to starting an assessment. Since I have already done a periodontal assessment for this patient, it will ask me if I want to load the last assessment values from the last assessment. For today, let's choose Start a New Assessment. You would choose Start a New Assessment if the patient hasn't been in the office for some time and there may be great changes to his or her periodontal health. The perio exam date will default to today's date, but you can change it to reflect the date of the exam if it's not today. Prepared by is a place where you can indicate who performed the risk assessment. It could be your first name and last name, your initials, and/or your credentials. Whatever you choose, this will print out on the oral health report at the end. Under Responsible Clinician, you will select the dentist who is responsible for the care of the patient. So now we will answer some questions about a hypothetical patient, including smoking and diabetic status. For this patient, we will enter that they smoked for less than 10 cigarettes a day for 10 or more years and quit less than 10 years ago. For diabetic status, you could enter either not diabetic or unknown, good diabetic control, fair diabetic control, or poor diabetic control. For this patient, let's choose fair diabetic control. Then you check any clinical conditions that apply to your patient. So is oral hygiene improvement needed? Has any scaling and root planing ever been done? Do furcation involvements exist? Are there any vertical bone lesions? Is dental care frequency not as regular as advised? Has periodontal surgery for pockets ever been done? Do subgingival restorations, are those present? And is there any subgingival calculus detected by either radiographs or exam? So now we're going to enter the deepest pocket per sextant from the gingival margin to the base of the sulcus. So for this particular patient, we'll say that in the upper right and the upper left, they have 5 to 7 millimeter pockets of bleeding, and everything else is within normal limits. Now you will enter the distance from the CEJ to the bone crest. And this is done using an eyeball estimation from a bite wing x-ray. You have 3 choices for data entry. 2 millimeters is normal, between 2 and 4 millimeters is moderate, and anything greater than 4 millimeters is excessive bone loss. For this patient, we'll say that he has some bone loss on the upper right and the upper left, where they had some pocketing. All of the questions are within the scope of practice for a hygienist to answer. By selecting treatment options, this gives some evidence-based suggestions on the report. Choosing the AAP surgical emphasis, this is going to notate surgical options for therapy that are consistent with the American Academy of Periodontology guidelines. If you choose laser therapy in your office, then you can click on laser therapy, which will generate a message about laser technology and the treatment recommendations of the report. So once the data is entered, we have 3 options to choose from. The first one I'd like to go over is Save for Later. If you're not done with the assessment, you can click Save for Later. But this option also allows you to pre-populate clinical data about the patient before the patient is sitting chairside. This is extremely important when you have patients of rapport and up-to-date radiographs and charting that you can populate prior to the patient coming into your chair. So let's go ahead and click Save for Later. And this will bring us back to the patient details page. And here's the periodontal exam that we started, today's exam date. There's no date yet submitted because we have not finished the exam, and there are no scores yet. So you can access this, this exam by clicking here or by navigating to Unfinished Assessments, which I will show you. And it will show up right here. You just click on the exam date. If you have anything to change once the patient is back chairside, you can go ahead and change it. Then when you click Finish, It will not only generate the report for the patient, but if the patient has an insurance carrier that adjudicates risk-based benefits, the scores will also be sent to the insurance carrier. By clicking Finish, you're indicating that what you've entered about your patient is true, accurate, and current. And this is what's going to generate this oral health report. So let's talk a little bit about the report. On the top heading, when you sign up for your free PreViser account, you have the option of uploading a picture of the doctor or logo of the practice here. The practice information you confirm upon creating your account will also appear at the top of the report. This is really a great marketing opportunity for your practice, and it can include not only the address of the practice, but also your practice phone number and website. On the right of the report, you'll also see a tooth forecast or a gum forecast, and that's generated based on the clinical data entered by the clinician. And this goes anywhere from sunny to stormy with a lightning bolt, and it's another nice way to engage your patient. The periodontal risk score will show the likelihood for future periodontal disease or progression of the disease without interventions to prevent the disease or to arrest it from progression. The periodontal severity score, or the gum disease score, quantifies the current disease status. Because the scores can change within severity silo, this gives the clinician the opportunity to recognize the minute periodontal changes and address them at their earliest stages. A nice feature of the periodontal report is the measurement for periodontal stability. Even though someone will never truly get back to health once diagnosed with moderate periodontal disease, they do have the ability to stabilize the disease and maintain current bone levels. So a great motivator for the patient is periodontal stability score, which will improve over time, provided that the patient's periodontal disease is not progressing. The What Changed graphs shows the progression of the patient's disease, whether it's positive or negative. And it can help the provider identify the need to modify the patient's treatment plan, as well as motivate the patient to better home care and treatment compliance. The report also provides graphics about disease status to a patient. So when we scroll down here, based on the clinical information that I had selected about this particular patient, this is going to generate graphics plus an explanation of why it contributes to the progression of the periodontal disease of the patient. I can't tell you how many times I've held my two fingers in a V to explain furcation involvement and my other finger to demonstrate bone loss and the severity of a furcation. Well, the OHIS report will generate those graphics based on what you've selected, as you can see here. And if the patient was totally healthy, none of these graphics would appear, again, making the report very patient-centric. So what to do with the report? It is certainly recommended to share and print the report, especially if the patient shows negative progression. But the finished reports will always be saved in the patient details, so you will always have access to go back to view the report. But what happens when a patient says to you, "How can I get to be a 2? I don't want to be a 4. Numbers resonate with patients. So that's where the Model This Patient option comes in handy. So let's go ahead and show you what that looks like. You'll hit back on your browser, and then we'll select what we can change here. So we'll say that they've resolved those pockets on the upper left and upper right. There's no more subgingival calculus. They're coming in every 3 months. The oral hygiene looks really good. They've got their diabetes under control. And that's it. So then we'll just scroll down and click Model This Patient. So Model This Patient assessments, because of their hypothetical nature, they're not saved in the patient's record, nor are they submitted to the insurance carriers for risk-based adjudication of benefits. Only the finished assessments are saved and submitted to the insurance carriers. So let's go ahead and hit Model This Patient, and it will display an oral health report that looks very similar to the one when we clicked Finish, except it says Modeled Patient, the assessment is not recorded, for the reasons I had previously talked about. Again, it will give the gum disease score of what they would look like if we started doing the things that the clinician had recommended, plus coming in for the care that the clinician had recommended, and then being compliant with the treatment and oral self-care at home. So as you can see, this can be a really nice motivator for the patient to see that their scores can improve if they do what you ask them to do. Okay, so when a patient comes back in, as you saw before, you do have the ability to load the last assessment values. And here's where you're going to save time. So let's say this patient does now have good diabetic control. Oral hygiene looks good. They're coming every 3 months. We've gotten rid of that subgingival calculus. They've resolved that upper left, but let's say they still have a 5 millimeter pocket on the upper right. And everything else is the same. That's how quick doing a reassessment of your patient is. It's pretty quick and simple. You hit finish, and it again will generate the report for the patient. So the tool is very intuitive in terms of use. And if you have any questions or concerns about the tool, please reach out to us at www.previsor.com. You can email us at help@previsor.com, or you can call our 800 number at 888-854-0007.